Okay, so now I'm going to be performing my tube feeding on Miss Sally Smith. I have my doctor's orders here. My doctor has ordered for her to have Glucerna, 1.2 calories, 240 mLs, bolus feeding every 6 hours. So we're gonna go ahead and administer her Glucerna via her PEG tube. Obviously, we don't have a real PEG tube, so I just set up an NG tube that my patient's gonna be getting her feeding through, but this is her PEG tube. So I would let my patient know exactly what it is that we're doing. Prior to me beginning my my feeding, I'm gonna go ahead and perform an abdominal assessment. So I'm gonna inspect her abdomen, then I'm going to go ahead and auscultate. I'm gonna start here in the right lower quadrant. Gonna make my way up. And I'm hearing some active bowel sound, so I don't have to listen to it for a full minute. But if I did not, I would have to listen to it for 5 minutes. I hear bowel sounds in all 4 quadrants, and then I can go ahead and palpate. I would have performed my kiwis prior to starting. I got the camera set up this way so that when I actually do start my feeding, it's pointed just at my whole setup and everything that I'm gonna be doing. I would palpate my patient's abdomen, and then I'm gonna also go ahead and assess her PEG site, and I'm gonna be looking at the stoma, assessing her PEG site, and it looks nice and clean, dry and intact, and good. So we can go ahead and use the PEG to administer her feeding. Now that I've done that, I'm gonna go ahead and wash my hands. I've performed my kiwis and go ahead and put on my gloves. I've gotten my Glucerna. It is the type that the doctor has ordered. I'm gonna go ahead and check my expiration date. The expiration date states that it is 2022. Okay, so that's good. Prior to me starting, I will go ahead and shake it, and I would clean off the top. I would wipe off the top, and I'm shaking it. Okay, that's there. I've got my syringe and my water that I'm gonna use. I've got my emesis basin and then my my tube here. So I've done my assessment. Now I'm gonna go ahead and begin. So prior to me starting, I'm gonna check the placement of my tubing. So I'm actually gonna stand up for these parts. I'm gonna check the placement of my tubing, leaving this here just in case. I'm never gonna use the bottom port, just gonna unplug here. I'm gonna take my syringe and I'm gonna go ahead and insert, and I'm gonna pull back on it. To see if I get anything out. Okay, and I get about 30 mLs of GRV back. So I'm gonna go ahead and push that back in and then leave just a drop to use on my pH paper. My pH is 3, so I know that it's in the right place. So I can also go ahead and, while I'm doing this, I'm gonna go ahead and stop this back up. I can use my stethoscope and push air into my tube to assess for the assess any sounds I hear. So I can go ahead and do this. Actually, 1 second. I'm gonna pull this up. I'm gonna pull up my 30 of air, connect it to my port. I put that in, must be the wrong side. Connect my port here. My patient needs to be sitting up. Then I can go ahead and put this on my hair and push in. And I can hear the bowel sounds in my patient's abdomen. So again, placement is in the right place. Now that I've done that, I've cleaned off the cap of my Glucerna. I've checked my expiration date. So now I can go ahead and begin to administer my feeding. So I'm gonna go ahead and pop the actual syringe out and connect it here. And I'm going to first flush with water. I don't know why I put that back in there. There's about 30 of water. I'm gonna let that run. Okay, now that I've done that, I'm gonna go ahead and I've already checked my expiration date and cleaned off the cap of my Glucerna. I'm gonna go ahead and administer that to my patient. That's kind of chunky. I'm just gonna raise it up some to help the rate go a little bit faster. If it's going slow and I want it to go a little bit faster, I can just take my syringe and pop it in there just a little bit, which I did. I'll go ahead and do that again. Not too far down. Okay, I'm not gonna pour the actual Glucerna one in there because I'm gonna use this one here. Okay, I'm adding some more of the Glucerna. And that's at 40. And let that all go down. Give it a little pop, pop it back out. Go ahead and give it another little pop, pop it back out. I can raise it up to make it go a little faster, which is going, and then it's all going down. Okay, I'm gonna go ahead and administer a little bit more her Glucerna. I'm putting in at 60. And let that all go down. Okay, so now that I've administered the entire can of Glucerna, I'm gonna go ahead and flush it again. I did 40 of water. Once I'm done administering my patient's feeding, I would assess her for any nausea, vomiting, if she has any pain. Okay, so now I can go ahead and I'm actually gonna do it one more time with another 30. So I'm gonna document that I flushed with 70 in the end, and at the beginning I flushed with 30 cc's of fluid. So that's 100, and I gave her 240 mLs of Glucerna. Okay, so I can go ahead and remove that. Stop her port back up. Okay. Then that is it for my tube feeding. I would keep her up elevated for about 30 minutes to 1 hour following this so that she doesn't aspirate. And then in 6 more hours, I would perform her next feeding, do another abdominal assessment. Thank you.